Hello everyone, welcome to Talking Out with Dr. Laz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. This is our last show for year 2021, about the 47th show we've had this year out of a total of 65. It's been fantastic. I really thank the production crew, the broadcast crew, all our guests, all our viewers, everybody, because without you, without all of us, perhaps we wouldn't have done up to this number. Year 2021 started on an interesting note. Recall that 2020 was dominated by COVID-19 and 2021 wasn't any much different, just that, of course, the economy opened up and a lot of other issues came on board. Our first show for the year, this year, was on 5th January. And we looked at a review of the management of COVID-19 pandemic. By then, vaccination wasn't an issue. But much later, of course, the vaccines were out. Certain doses came to Nigeria. Health workers and other persons were prioritized. It's still an issue. There's still vaccine hesitancy. Some persons not vaccinating for various reasons. And also even expiry of the vaccines that are brought to the country, despite the fact that we don't even have enough. Vaccine appetite at the global stage, hoarding of vaccines by richer countries, discriminatory immigration policies against African countries and some other parts of the world. So many issues so far related to COVID-19. Of course, there is a video that is being circulated online recently related to this, and I can't confirm the validity of the video, but it's something of concern in Ghana, where a Nigerian was claiming that the COVID-19 test they did, red negative, and other officials did the same test, within 24 hours, and he was testing positive, kind of protesting. I'll allow you watch a bit of that video, and of course it's something we are going to be following up with as the debate and issues around COVID-19 control keeps heating up. Just have a look.
These guys are running a sham. People tested negative yesterday, and there they are saying our tests are positive. Can you see them?
Do you know it's not allowed?
I don't care. You're holding me here against my will. You're holding me here against my will, and you're telling me that tests that people did yesterday that came out negative, you've tested it, and now it's positive.
I've tested twice,
and it came out negative. And now they're saying it's positive. Look at them. This is what they're doing. This is what the Ghanaian government is doing to people. They're extorting people intentionally. The Ghanaian government is extorting people intentionally, intimidating us and making us pay afterwards. This is what they're doing to Nigerians. This is what they're doing to people. This is what they're doing to people. This is the doctor here. This is what they're doing. People have tested negative and they're still telling us we're positive. Why are you holding us here? Why are you holding us here? This is what they're doing.
I did this test yesterday.
And it came out negative. You call an independent lab. Call an independent lab. They'll tell you your test is negative. There's nothing wrong with you. You're not sick. Then they go do the test themselves. Then they come back and tell you, oh, you're positive. You're sick. Because you want to collect money in this rundown hotel. They don't even get to clean the hotel rooms. Nothing. They don't do anything. Look at the hotel rooms. They don't clean it. They don't do anything because they want to get money off you. This is what the Ghanaian government is doing. This is exactly what the Ghanaian government is doing. They're extorting people. They're extorting people. After which they'll tell you after 7 days you have to pay $700. This is what they're doing to us. Then they come to intimidate us.
Another issue that dominated discussions in the health sector in 2021 was a strike by resident doctors that lasted over 60 days. A lot of issues around the welfare of resident doctors in Nigeria, the hazard allowance issue, payments of medical residency training funds, in addition to many other concerns on work conditions. Of course, it brought up the issues of brain drain during the period we had cases of recruitment by Saudi Arabia and other foreign authorities, and media reports of thousands of Nigerian doctors who are immigrating for various reasons is something that we do hope in the coming year the authorities at the state and the national levels is going to ensure that all these issues are resolved. We should not have a recurrence of doctor strike. Also, there's a lot to review today before we get into our major conversation that revolves around hypertension. You may have seen an interesting video trending online where a quack, who claimed to be a nurse was, having some interesting opinions about hypertension. But on this show, where you can trust any information you're getting, where our guests are experts in their field, you are going to be hearing the facts about hypertension, the prevention, the causes, and all of that. But before we go into that conversation, I would also like to talk about the hoax that started just a few weeks ago, the one they called AA genotype disease. Have you heard about that? In case you've not, there's flu in the air, I must say that, and I actually made a post on my Facebook wall recently about that. There's flu in the air, you might speculate, could it be COVID-19, could it be the Omicron variants of COVID-19, could it be the regular flu that we used to have towards this time of the year, especially dry season. You get a flu that comes during early period of rainy season. You also get the experience that, But what's important for you to know is that there is no disease known as AA genotype disease. There's nothing like that, So, and I am AA, and I can't remember having any illness that warrants treatment in the last 4 or 5 years. So, and I do not suffer any fall ill very quickly, despite the fact I'm AA. So with so many other persons. So, but if you are feeling ill, please go and see a healthcare provider so that appropriate diagnosis will be made and appropriate treatment given. Don't self-medicate. Many persons just start taking anti-malarial and antibiotics, self-medication. When you abuse antibiotics, it predisposes, to resistance, which is not good for our population. Okay, so we've had enough on that conversation. There is a community pharmacist who may likely join us in the course of this program to share some insights on the abuse of antibiotics, especially with flu illnesses that have similar symptoms like malaria, but it may not actually be a malaria. We're going to take a break right now. So when we return, I'll be introducing my guest, who is a consultant physician at the University of Maiduguri Teaching Hospital in Northeast Nigeria, to have expert conversation on hypertension. Do stay with us. We'll be right back.
Dashing through the snow in a one-horse open sleigh, o'er the fields we go, laughing all the way. Bells on bobtail ring, making spirits bright. What fun it is to ride and sing a sleighing song tonight! Oh, jingle bells, jingle all the way. Oh, what fun it is to ride in a one-horse open sleigh! Hey, jingle bells.
Welcome back to Talking Health. Dr. Laz, your favorite health program on television. Yes, our last show for the year, and we are touching on a number of issues and clearing some fake health messages that is circulating all over the place. Before we took a break, I mentioned that we are going to be talking about hypertension, especially in view of the viral video of a quack who was granting an interview on a television station, I think Edo State Broadcasting Service. The Nigerian Medical Association in the Edo State chapter had already issued a statement to condemn in strong terms why a broadcast station should get such quack to relay, very fake information to the public. You may have seen the footage on the screen. We are not going to play that because we don't want anybody to get that fake message. But if you've seen anything like that, don't believe any of the things that is said on that video because it's not true. Hypertension is not by thinking, and hypertension is not a major problem for children and all the unacceptable information that were passed in that video. But an expert is going to speak on that very shortly. But I mentioned about the drug abuse and the so-called AH type disease, but this period with a lot of flu in the air. And I want to quickly ask Okpayami Akindele, who is a community pharmacist, on the implication of self-medication and persons resorting to self-help, especially this period where there's a lot of febrile illnesses. Mr. Akindele, welcome to the program. Join us from Ibadan, Oyo State, Southwest Nigeria.
Yes, thank you, Dr. Laz. Thank you for having me.
Hello, Mr. Akindele, if you can hear me, can you quickly speak to the implications of the self-medications that a lot of persons get involved in trying to resort to self-help in managing the common febrile cough and catarrh, headache, and symptoms that are very similar to what have been said to be symptoms of Omicron COVID-19, but also similar to other flus, malaria, and febrile illnesses in the country. What is the implication both to individual and to the population when people just get to take antibiotics and anti-malaria?
Okay, yeah. Well, much of what we see at the community level, there are indications of the deeper problems that we have in our healthcare system. So where people don't really trust the government facilities, so they resort to self-help. And of course, people Google symptoms a lot, and whatever they see online, they just believe it. And in fact, you see people go as far as going to a lab to have an X-ray done, by themselves. These are some of the issues we have. So, but then, given this, the current weather, harmattan, dust, and all of that, so you have people talking about, oh, I have catarrh, I have running nose, my nostrils are blocked, scratchy throat, slight fever, and all of that, mild cough to severe coughs. And of course, the healthcare system, is not properly controlled. The control we have currently, the structure are still weak, so people can obtain, medications anyhow. Even if they come to a pharmacy and we say, no, you have to see a physician for this, that doesn't necessarily guarantee that they can't get their medications elsewhere and still abuse it anyway. So, but currently, those are the symptoms.
Okay, thank you very much, Mr. Akindele, for those insights. I'm sure we're going to have a more detailed conversation on this topic on a later date, but I want to sincerely thank you for joining us briefly, but it's a conversation we are going to take forward. Thank you, sir.
Thank you very much, Dr. Lab.
Yes, Mr. Akindele Okpayami joined us from Ibadan, Oyo State, Southwest Nigeria, and he's a community pharmacist and founder of A-Star Farm Healthcare in Ibadan. Thank you, Dr. Omar, for joining us on the program. He's a consultant physician, a nephrologist, that's a kidney disease management specialist at the University of Maiduguri Teaching Hospital in Northeast Nigeria. Thanks for being on the program, sir.
It's a pleasure to be here.
Great.
Thank you, Dr. Las.
Thank you, Dr. Loskurima Omar. So now getting into the real conversation, What is hypertension or high blood pressure, as a lot of persons tend to call it? How will you describe it to a layman?
Okay, thank you very much. I think to say it in the layman's term, high blood pressure simply means abnormally elevated blood pressure. Everybody has a level of blood pressure that can be considered as normal, and that has to do with the person's age. Because as one is growing, as one is coming of age, it's expected that the blood pressure should also go high. What will be normal to a person that is, let's say, 20 to 30 years may not actually be normal to what is someone that is 50 to 60 or 70 to 80. So a blood pressure that is normal to someone that is, let's say, 80 years old may actually be high to someone that is 30 years. But to a layman, what we consider normal usually, or optimal blood pressure is usually what less than 120 over 80. So that 120 is what the medical personnel will refer to as systolic blood pressure, and then that 80 is what we refer to as diastolic blood pressure. Then now I will come back to what I discussed about age now. So high optimal blood pressure can be actually a blood pressure of above 130 but less than 139, and then the systolic above 90 but less than 100. So that can actually further, again, the other part classification would also include pre-hypertension, grade 1, grade 2, up to grade 3 hypertension. And all this has to do with the level of blood pressure that is measured in various individuals. But as I've said earlier, what can actually be normal to someone that is 70 or 80 years old can actually be high to someone that is, let's say, 30 or 40 years.
Okay, that's fine. So you've already mentioned age as a risk factor, for perhaps blood pressure that could be considered high, especially for those who are younger. So can you speak a little more about the causes and perhaps risk factors for hypertension?
Okay. So hypertension can actually be classified into two, what we call primary hypertension or secondary hypertension. Primary hypertension by far is the most commonest form of hypertension, and that's considered about over 90% of hypertensions are known to be primary hypertension. By primary, it simply means that it does not have any non-cause. There's no cause for primary hypertension. Then now the remaining percentage was considered about less than 5%. We refer to them as secondary hypertension, and these ones may actually have causes. So causes will now include things like kidney diseases, yes, things like abnormalities of the vessel, things like abnormalities of now some parts of some glands in the body, let's say adrenals or thyroid diseases. So the list actually may be too complex for me to start mentioning in this discussion. But we should understand that majority of hypertension does not have a non-cause. That's the primary hypertension, while the secondary hypertension may actually have a non-cause. But there are some risk factors that can be considered in hypertension, and that will include if one has a family history of hypertension, let's say the father or to a lesser extent the mother is hypertensive, then the chances are that when that particular individual grows, he or she may likely be hypertensive later in life. And this will take us to the concept of now what do we do to likely prevent hypertension if we have such risk factors. So maybe I stop at that. While you're asking, I may shed more light on other things about hypertension also.
Exactly. There are some behavioral factors that might contribute to or predispose one to having hypertension. Are there dietary factors?
Yes, very well. There are, especially if a patient, let's say, is having overweight or obesity, what we call obesity or overweight. Such patient is actually now predisposed to develop hypertension. Likewise, certain diet, for example, taking excess salt, for example, may actually be a risk factor for hypertension. Likewise, consuming high now calorie diet, that will predispose the patient to develop hypertension, and then later in life, that particular individual may also develop hypertension. So these are basically the lifestyle forms. Or sedentary lifestyle, not exercising, for example, is another risk factor for hypertension also.
All right.
So basically, these are the few ones that I would say in this discussion.
Okay, thank you very much. We're going to take another break. And when we return, I'll quickly ask you about what someone has to do, how is it diagnosed, how is it managed, and any other tip that will be important to our viewers. Do stay with us. We'll be right back to continue this conversation on hypertension.
Dashing through the snow in a one-horse open sleigh. O'er the fields we go, laughing all the way. Bells on bobtail ring, making spirits bright. What fun it is to ride and sing a sleighing song tonight! Oh, jingle bells, jingle all the way. Oh, what fun it is to ride in a one-horse open sleigh! Hey, jingle bells, jingle bells.
Welcome back to Talking Out Dr. Laz, your favorite health program on television. I've been talking with Dr. Loskurima Omar from University of Maiduguri Teaching Hospital. He is a consultant physician at the hospital in Northeast Nigeria, and we've been discussing the causes of hypertension. Dr. Omar, welcome back to the program. So,
Thank you, Dr. Laz. Thank you.
thank you very much. So how do we diagnose hypertension? Of course, by checking blood pressure and all of that. But one may want to ask, how often should one get to check it, given that in many cases, hypertension begins without showing any sign or symptom?
Yeah, hypertension per se, without affecting any organ, does not have any particular system, does not have any particular symptom. Is actually what we call asymptomatic. That means it doesn't have any symptom except if it has caused any damage in an individual. But ordinarily, just elevation in blood pressure will not give any symptom to the person. So that is why it's very important for us to be checking our blood pressure regularly. Once we pass the age of 30, let's say every 1 year, 6 months, we should visit our various clinics to have our blood pressures checked. You can hear Nigerians boasting that I'm now 50 years, 60 years, and I've never been to the hospital, not knowing that there's actually something deep inside that is actually damaging their organs. And once they present it, probably it may be too late. It might have damaged some organs. So it's important for us to be checking our blood pressure regularly, especially after the age of 30 or 40 years.
Okay, so that's a very good point there, after the age of 30, 40 years, to check it at least once in a year. So how do we manage hypertension? Does it have a cure? Especially primary hypertension.
The primary hypertension that we talked about as earlier said does not have any particular cause, so it doesn't have a cure. All we can do is to manage. And management can be done when the person visits the hospital, sees the doctor, and then the doctor asks you what to do. Is it dietary now? Is it or pharmacological? Pharmacological, I mean, are you going to be placed on a particular drug? And these are the ways to managing it. But the primary hypertension does not have a particular cure. Now, the type of hypertension that has the cure is actually the secondary hypertension. So secondary simply means that there's a particular cause for the hypertension. And what do you treat that cause? The person now will have a normal blood pressure. But the primary one, which is actually the most common form of hypertension, does not have a particular cure. If you're told to be hypertensive, now it's good for you to be regularly visiting your doctor. It's good for the person to have to regularly check the particular medications that will be prescribed by the doctor to that particular individual.
Okay, thank you very much for those thoughts. Finally, what are potential complications of hypertension in the event of not diagnosing it, or in the event of not managing it properly when diagnosed?
So not only by not diagnosing it, even if hypertension is diagnosed, if one is not following the rules that were stated, hypertension can actually cause damages. And then damages that we're talking about now, we refer to the various important organs in the body. Now, these organs, first of all,
it's like we're having a network challenge there, Doctor.
The hypertension can actually be placed. Yeah, sorry, I had to reject your call, sorry. So, as I was talking, hypertension affects the important organs.
Dr. Loskurima Omar is talking.
So, am I audible? Can I continue?
Okay, please, sir. Yes, you may continue, sir.
Okay, what I'm trying to say is that hypertension has complications, and then the complications has to do with affecting most of the important organs that we have in the body. So to list a few, One, it affects it surely as a result of hypertension. Secondly, it can affect the heart. What the layman now hears doctors saying or medical people saying heart failure, common cause actually is hypertension. Then it also affects the brain. Now, when the blood pressure rises, it now actually affects the vessels that are supplying the brain, and that can cause what we. It can also affect the vessels that will supply the various organs, and then narrowing at times, and then these major organs can actually be compromised of blood supply, and that can cause affect most of these organs. And once these organs are affected, most at times they may not actually be reversible, and that is that further will make us emphasize it.
Okay. I think he's touched most of the complications. He's touched on most of the complications of hypertension. Dr. Loskurima Omar is a consultant nephrologist at the University of Maiduguri Teaching Hospital, Borno State, Northeast Nigeria. Thank you very much. The network wasn't so friendly, but I think we got the points you made. So I really appreciate you for honoring this invitation to be on this program. And I believe that our viewers would have been very much enriched. One thing you must take away, which he said is a specialist in this area, is that over 90% of cases of hypertension, the causes are unknown, medically unknown, and does not have a cure. The other 10% or less than 10% is the one that you know the causes, and of course you could cure that when you identify. And it does not show any sign. It's a silent killer. And the World Health Organization made that very clear, on its website and other information. Okay, that's the much we can take on the program today. Really thank you once again for being part of this show. We hope you enjoyed the Christmas, and we pray to see you next year as we keep talking health on this channel. So on behalf of the production team and the entire Talk Health Nigeria and Dark Communication, the producers of this show, as well as those who are in charge of the broadcasting, we wish you a very pleasant New Year 2022. My name is Dr. Laz Eze. See you next year. Same station, same time next week. Bye for now.